Thank you. I see my little red light, so I know it's good to get started. I want to thank everyone for joining us today. This is our July evening town hall presentation on electronic visits verification. We have, or visit verification, I always want to make that plural, electronic visit verification. We have been doing these presentations since November. My name is Brian Dowd. I am the Deputy Executive Director over Policy Operations and Compliance at the Department of Community Health and Medical Assistance Plans, which is just a fancy way of saying Medicaid and Peach Care for Kids. So thank you for joining us today. We start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable, quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do, we've reserved these later EVV town halls to go over what we see from you guys as key things that you need to get clarification on, or things that we see come up over and over again. First of all, we're going to do a little breakout, just a couple of slides for self-directed members, because during the process, it has been made very clear that the self-directed members would like to be addressed on each and every presentation separately. So we're going to, besides doing specific targeted self-directed webinars, which are available on our website, we are also going to incorporate that into our ongoing presentations as well. Then we're going to talk about some other key topics like key fobs, the status updates and timelines, benefits of EVV. We're going to give you a lot of information about EVV training. And I want to stop here for a minute because there has been some confusion that these town halls are your trainings. They are not your trainings. They are monthly touch points between the department, NetSmart, Conduit, and you all as our key stakeholders, providers and members, and anybody else who is interested. But they are not intended to be your sole training resource. They are just touch points. So we're going to go through all those training resources because it's very important that you as a provider are engaged and doing your due diligence that you need to do to go through the EVV process in order to be a provider. So that's going to be a big key point in today's presentation. Also, common issues or questions. We're going to go through that, get a few of those that we hear over and over again. Then, excuse me, I'm going to take a little bit of a break. And Joe's going to do a few demos on some things that we're hearing a lot, so you can see him walk through it on the NetSmart solution. Then I'm going to just give you the call center resources, talk about the town halls, do a little third-party update, and do some questions and answers. So let's start with our self-directed updates. So one of the big things that we've learned since doing the individual fiscal intermediary town halls is that each of the fiscal intermediaries are implementing the EVV methodology in a separate way. Acumen and Public Partnership have their own EVV systems. Continuum is using the TELUS EVV system. And they all have different timelines for implementations. So as far as this presentation goes, we're going to give you one slide where you can get your contact information, which is the next slide. And we're going to encourage you to go back and look at those targeted presentations that are available on our website, because you can get an overview of the DC system from Acumen there. You can also get an overview of the PCG system that they're going to be using for EVV implementation if you're in public partnership. Again, Continuum will be using the TELUS system. They are in the process of getting that all up and running so that they can provide training here in the very near future. We have meetings with them every 2 weeks, actually a little more frequently than that right now. And we are moving forward with all three vendors towards implementation. So if we go to the next slide, I'll give you the resources that are specific to each of the fiscal intermediaries for self-directed members. These are emails specific to Acumen and a contact center I have heard over the last week that there's a bit of a wait time to the Acumen call center, and that is because so many folks are marching forward with getting incorporated to the DCI system. This presentation will be available on the website as well. If it's not already available, it'll be available very shortly, and it will contain these links that you can go to specifically to get to the town hall recordings, but they are available on the website as well for each fiscal intermediary. The contact information for Continuum is here as well, email and phone number, and then an email specifically for Ms. Talley at Public Partnership. And she is the lead for EVV and the person you should contact. Okay, now I'm going to pause here just for a second to let the self-directed folks know that the rest of the presentation you're welcome to stay for if you would like to. Certainly, everything is open and transparent. I also want to encourage you in your communications, and I'll talk about this a little bit later with the traditional providers as well. In your communications with the department and with the department's agents like TELUS, Conduit, Gammas, to remain very professional in what you send to us. There have been some concerns about some of the communication that has come, and it's really important for self-direction, which is an optional program, for folks to remain very professional so we can work through your issues. We will continue to do that with you, and that is our expectation for our members as well. So again, you feel free to stay on. We appreciate your input as always and your questions. Next slide, please. Okay, I want to revisit key fobs again. So, and I have an update to this that from even our presentation that we did yesterday. So we won't be utilizing key fobs as we originally said with the EVV program. And the reason we're not doing that is simply because it's not an industry standard to use anymore. It's not a best practice. So we decided that we would not use key fobs or fixed devices. So the mobile application is strongly preferred, and you actually have to have a valid reason if you want to use IVR, which is just a fancy way of saying a telephone line. There is a form on the website for traditional providers and self-directed members that they can fill out and request the use of telephony or that telephone line. But it needs to be in circumstances where the employee, the caregiver, does not have a smartphone, or there's a religious reason why the member or the employee cannot use a smartphone, or a medical reason why the smartphone cannot be utilized by the employee. The employee or let's say the member has an electronic sensitivity disorder, then that, if documented, would be a perfectly allowable reason to use telephony. For those members who need a smartphone, instead of a fixed device, we are pointing you to the Georgia Lifeline. Georgia Lifeline is a free federal program which provides free phones for Medicaid members. If you are on one of our waivers and receiving Medicaid, you can receive this free phone through Georgia Lifeline. Not only is the phone free, but all texting and calls are free on the phone, so there's no cost for that. There is a limited amount of internet data, but what we learned today is EVV is exempt from data usage on the Georgia Lifeline phones. So even if you were to use all of your free, essentially minutes for internet usage on the Georgia Lifeline phone, you could still utilize the phone for the Wi-Fi in order to do the EVV functions. Those functions do not count against the data that is available on a free Georgia Lifeline phone. So if your employees don't have a phone and there is no telephone to request telephony, you will need to request, the member will need to request a free smartphone that they can use in their house that will act essentially just like a fixed device. I also learned today from the Georgia Lifeline people that from completed application to the day that it gets at your door is 5 days at the most. They're actually running about 3 days right now, but 5 days, and the application process is completely done online. Next slide. Status update. So many of you know that we have pushed back the mandatory claims submission date through EVV to October 1st, 2021. We did that based on our own internal metrics and also from provider and member input, because we always appreciate you guys' input. But we are very unlikely to push this date back any further. And one of the things that we are doing is we are instituting actionable steps between now and October 1st to make sure we are implemented, because there is really will be no excuses for pushing the date back any further. So as of July 23rd, 2021, all CLS, community living support and personal support providers are required to register for the NetSmart system. All they got to do is register. So that you still have, what's that, a couple of weeks yet, and all you got to do is register, more than a couple of weeks to use EVV. If you don't register by July 23rd, 2021, you will be placed on prepayment review, and you will not be able to process claims through GAMUS unless they are manually released by the Department of Community Health. So all you got to do is register. If you register, you could continue to submit your claims through GAMUS. As of August 31st, you need to have all of your employees inputted into either the NetSmart EVV system or your third-party EVV system. And you must successfully submit one claim for each ID through the EVV system. So each one of your EVV systems IDs that you may have for your multiple location, you need to submit only one claim successfully through the system as of August 31st. So that gives you another 5 weeks to load all of your employees, have somebody clock in and clock out, and get paid through the EVV system. Then you have another full month, the whole month of September, to get all of your aides on board, clocking in, clocking out, and submitting all the claims through the EVV system. As of October 1st, we are going to turn on the mandatory claims edit. And if you try and submit a CLS or PSS claim through GAMUS, it is going to deny with an error code that advises you that these claims must be submitted through the EVV system. Next slide, please. So we also do a lot of talking about just policy, but we've been doing a tremendous amount of member calls and outreach and provider calls and outreach. Both the NetSmart conduit folks and DCH internal folks have been calling. And we wanted to share with you some of the benefits that we've heard from the community. Things like not having to approve time daily, not having to submit timesheets, the increased caregiver accountability and real-time verification of services, streamlining of billing and payroll. We have folks who have been using the system for many years already, and they're continuing to use their EVV system where it talks about minimizing guesswork and scheduling and visit verification. These are actual quotes from providers that we have included. Next slide. So now I want to talk a little bit about training. So training is offered in a multitude of ways through NetSmart website. And you really should complete your training based on your role at the provider agency. So if you're using the NetSmart EVV system, administrators should register and complete the administrative console training, mobile application, and claims console training. Caregivers or aides who don't perform administrative functions only really need to complete the mobile application training, because they just need that functionality associated with the app, not with administration. For providers using a third party, you've gone out there and got your own EVV system that is integrating with the NetSmart system. Administrators should register for and complete the claims console trainings. The caregivers don't need to complete the NetSmart application training because they're going to be using your third-party application. So they need to complete that training that is available with your third party that you have selected. So EVV training, there is a ton of training available online. And Joe will talk about this a little bit when he walks you through. This is the website. This website is available on our EVV webpage. As you can see, there's administration, claims, mobile, all the things we just talked about. There's extra topics as well. There's a weekly scheduled training webinar that NetSmart does. And that's just an open Q&A. They have very low participation in it. So if you're having lingering questions, you can sign up for that and get one-on-one questions answered on the topics of your choice. You have tons of pre-recorded webinars that are available for your convenience as well. And those are available on this website. Next slide, pretty please. This is the training that I just talked about with a live Q&A session. I really want to encourage you, if you're having trouble, to access this. This is in that extra topics section that we just talked about. I hear a lot of, well, I don't, I haven't been trained. I don't know how to train. I don't know what's going on with training. Not only are all these trainings pre-recorded in town halls, but you have access to a weekly live Q&A session for any questions you may have. There is really no excuse for you as a provider not to take advantage of these trainings in order to become fully aware of the EVV compliance and the operation of the system. Beyond this town hall and the presentations that we do as part of the town hall and all the resources that are available online, if you need a checklist, we have those available on our EVV website. Just go to the EVV website and we have put together training checklists that will walk you through step by step what you need to do to make sure you are on board and fully ready for when EVV is live, completely live 10/1. We have heard great feedback about these checklists that we have put together. We've even had providers say, hey, this makes it easy. I can just go down step by step. So please do use those checklists. Once you actually are registered for NetSmart, which everyone will be required to do by the 23rd of this month, or they will go on prepayment review, you also have access to user guide and short refresher videos. I've seen all the short refresher videos. They're very useful and they're good for people like me who don't have the longest attention span. So you can just go in and watch short little 7-10 minute videos on specific topics. You can print the guides for in-person employees or download them for reference if you need to. And this is all available on your administrative portal. Okay, I want to go through some common issues or questions. So we've talked a little bit about the claims mandatory deadline being October 1st now, but some folks are already submitting claims. The normal MMIS processing to be paid at the end of the week is you have to submit your claims by noon on Friday. Don't know if you knew that, but that was the old rule. If you submitted your claims after noon on Friday, then you were going to get paid in the next week's cycle. Well, with the implementation of EVV, there is a nightly feed that runs at midnight on Thursday. So you need to make sure if you want it to be on this week's end of payroll, that everything up to Thursday is submitted so that it can process through GAMUS and appear on your end of the week pay remittance advice. So again, Thursday midnight, you need to have all your claims in for the week, or it's going to be next week that you get paid for those claims. Missing members or authorizations. We continue to get a lot of questions about this. A lot of the times we are finding missing members and authorizations by simply associating them with the correct ID. You have multiple provider IDs, and we're seeming to find a lot of them. But if you do have issues and you can't find the person or the ID or the PA, in any of your IDs and you need help, you need to call the Georgia EVV call center, and we'll give you those resources. I'm going to stop here again, like I talked about for the participant directed people. You as providers are contractors of the Department of Community Health, and we expect as our contractor and working on our behalf a certain level of professionalism from our providers. And that's not because we just like to mandate things. It's actually because if you lack professionalism in your daily operations and communications, then we worry about the care you give our members. It is literally a quality of care issue for our members. So things like cursing at the call center is not acceptable. Yelling and screaming at the call center or a member of the Department of Community Health, threatening text messages to members of the Department of Community Health, including myself, is not acceptable and quite honestly will not be tolerated. It is a professional standard of decorum that we all need to uphold and keep. And I will refer you to the Part 1 policy manual that leaves it up to the department's discretion to who they enroll as a provider and keep enroll as a provider for any reason, including standards of professional conduct. I know a lot of people don't read that Part 1 policy manual, but you attest to the fact when you become a provider that you not only have read it, but that you understand it and that you will abide by the policies that are associated in Part 1. So we just want to remind everyone, we expect that of myself and my staff to be professional at all time. And I know our leadership certainly expects that, and we expect it from our provider community as well. The next thing that's a very common issue or question that we need to go over is rounding rules. The way the system is, I've heard a lot of comments and concerns and complaints about the rounding rules. The way MMIS is configured right now is if you go 1 minute over a 15-minute unit, it rounds up. That's the way that it works. That's the way the system has always worked. So there's not an 8-minute rounding rule set up in GAMUS for billing. I understand a lot of providers have adjusted the number of units, whether it be the worker left 5 minutes early and they went ahead and billed for the whole 15-minute unit, or the worker left 5 minutes late and they pushed it back to the whole number, kind of following an 8-minute Medicare rounding rule. We are right now, we have a meeting tomorrow to go over those rounding rules very early in the morning. And we are considering, and it's very likely that we will adopt the Medicare rounding rules for 15 minutes associated with EVV as well. But for right now, you really just need to have conversations with your employees and your members to understand that if that worker goes over, that means an extra unit is going to be used in the 15-minute units. And it could lead at the end of the month or the end of the PA cycle, whenever that may be, daily or weekly, that there are not as many units that are available to the member. And we will communicate that via banner message and our normal communication streams, which is our website and all our social media, as soon as we have finalization on any rounding rule changes that we are going to make, which should be shortly. Next slide, please. Okay. I'm going to be quiet for a little while and turn it over to Joe. He's going to do a little demonstration for you on some common things. Take it away, Joe.
Okay, thank you, Brian, and good evening, everybody. My name is Joe Schnurr, and I am with NetSmart. I've been working on EVV for a number of years, and I look forward to reviewing some of the functionality that's been coming up in common questions. So here are the 3 items I'm going to review. The first one is toggling between provider IDs to find Medicaid members on the dashboard. So Brian had mentioned that some providers are having a hard time looking in their portal and finding specific Medicaid members and the associated prior authorizations. And what we find is that sometimes those Medicaid members are in a different provider ID, and providers get confused about how to toggle between the different IDs. So I'm going to show you that. And then there is a way in the tool that you can name the provider ID to make it a little easier on yourself to maybe associate that ID either with a program or whatever way makes the most sense for you, so that when you go to the drop down, you can actually understand what that ID is associated for. And then lastly is resetting passwords. We know that resetting passwords is a very common topic, and there is a way in the administrative portal for an admin to reset a password for a user. And I'm just going to show you how to do that. All right, so if you give me a minute, I'm going to switch over to the actual portal. So I'm going to stop sharing for a minute. Logging in to the portal. Okay, everything looks good. Start sharing again. Okay, so hopefully you all can see the portal.
We got it.
Okay, awesome. Okay, so I am logged into my demo unit. So this is a specific portal set up for demonstration purposes only. There's no production type of information in here. You can see up at the top, my home care name is Peachy Home Care for Georgia. And so the first thing I'm going to go through is this drop down. So you can see my drop down. I am, again, this is in my demo system. I'm an administrator, and I'm across several different agencies. And I realized that not all administrators work across multiple locations. But for those that do, and you have access to multiple locations, and you've registered for those locations, and you're all set up, you will have this drop down. So it allows you to very easily toggle between them. You don't have to log out and log back in. So we've made this very easy. Now you can see in my example, I work with providers in multiple states. So again, just for my example, you can see Pennsylvania and Florida and so forth. Obviously yours are different. I've named mine so that I know which state, if I need to speak to folks in Florida, then I know that that's this behavioral care of Florida. And when I click on that, it does say confirm that you want to switch. I say, okay. And now it's going to switch me over to behavioral care in Florida. So it's very easy to do. That's what that drop down is for. Now, let me show you how to set up those names. So once again, you've registered for them all, and they're available in your drop down. You just go into the specific location, and you go under the billing provider. And when I do, it pulls up my information for that specific provider ID. And you can see that all my information is here, my MPI and taxonomy, my address, and you can see right here something called short name. So the short name is the name that will show up in this toggle, this drop down. Now, what if and when you register, it will auto assign a short name. Sometimes the ones that they auto assign are not really what you want it to be. So the tool allows you to come in here and change it. So you can see this little pencil, this little blue circle with a pencil. When I hover my mouse over that, you can see it says edit. So if I click on it, it opens a little box. And you can see right here in the top right is short name. And I can change this short name. You just click in the box and delete what's there, and you can rename it to whatever makes the most sense for you. And then you just hit update. So it's very easy to do, should be very quick, and that way you can get all organized on all your different provider IDs, and you'll be able to toggle between them very easily. So that's as easy as it is to come in here and adjust that name. So I'm going to cancel because I'm not going to change my name. And I am going to switch back to my Georgia Peachy Care. Okay, so now let's say the third thing that I wanted to share with you is the passwords and how to reset passwords. So let's say that a caregiver calls in and says, I forgot my password. Can you reset it for me? So first of all, the caregiver can reset their password from the mobile app. And my guess is you're going to want to make sure they know how to do that, because you're not going to want to continue to always have to reset their password for them. But if you do want to, if you set up a policy and say, oh, I always want you to call in and we'll reset it for you, no problem. The tool allows you to do it. So I go to my users. These are all my users, set up my demo. And you can see over on the right, there's these three little dots. When I click on those dots, a little box comes up and allows me to do some different things. And one of those is reset the user's password. Now, I'm not going to click on this because when I do, I'm going to reset the password for this user. In my example here, this is Crystal Miller. So Crystal doesn't want me to reset her password, so I'm not going to do it. But it's this simple. Click on the three dots, the little box comes up, reset user password, and then that user will get either an email or a text to reset their password. And it will give them like a temporary password to use, and then they'll have to log in and create a new password. So again, very easy to do. And the use case that I do see pretty frequently is when you load your caregivers, really any user, they only have 48 hours to log in and basically confirm that they want to be part of the agency. And you can see here this thing called invite status. And you can see a lot of these are accepted. However, you see one here, it says invited. So what that means is I invited Mike, but Mike never accepted the email and logged in for the first time and changed his password. And once he does do that, it will flip to accepted. However, Mike only has 48 hours to do that. And then the temporary password will expire for security reasons. And then when that happens, you're going to have to come in as the agency administrator and reset Mike's password. So again, I'm going to have to click on the three dots and hit reset user password. And then Mike will get a refreshed email or text. And you can see here that Mike did not include his phone number, so he can't get a text, but he did include his email. So he'll get an email. And so he'll get a new email with a new temporary password, and the 48 hours, that clock will reset, and he'll have another 48 hours to use that password. If he doesn't, I'm going to have to come in here and reset it again. So that's a pretty common use case of when the agency administrator will have to use this tool to reset passwords. Otherwise, once they do get set up and they are accepted and they've been using the app and they forget their password, because that will happen, the caregiver can reset their password right from the mobile app. And of course, in training, all of that, we go over all of how to reset their passwords. There's even a video for it. It's in the user guide. There's multiple different ways that we educate caregivers on how to reset their passwords. So since Brian did show you the training, I wanted to just show you again. Here it is on my left-hand side of my portal, training. And when I click on that, it says go to training. And when I click on that, it's going to take me to my training portal. Let me go back a page. I need to show you. It brings me to this page, which is the training resources, and there are multiple resources on here. There are user guides, so those that like to use that read stuff or print out. There's user guides for mobile, admin, and claims. For those of you that prefer video, we have all these video tutorials. So I'll go ahead and click on that because I think these are super useful. And while we do offer the full training and we do encourage you to go to that, you may just need a quick refresher on one component, and you may not want to sit through the whole training again. And so we created, you can use the user guides, of course, or you can come in and look at these short videos. So again, maybe you forgot how to add users. So there's a 12.5-minute video to show you how to add users. And you just click this watch video, and you will have to enter in your name and your email. And then it will show you the video of how to add users. And you can see there is a long list of videos on here. They're set up by claims or the admin portal, or here's the mobile app. And there's even some special topics that may or may not apply to you. All right, so I did want to just show you that because a lot of times, just for some reason, the providers, they never click on that training part on the portal. So I wanted to walk you through with that because I think it's super helpful. One other thing before I turn it back over to Brian is that I think you've heard probably multiple times that TELUS is now part of NetSmart. And as part of that, we are going through some rebranding efforts. So you can see, like on the portal here, it says TELUS up in the upper left-hand corner. So since we're really no longer TELUS, we're really now NetSmart, we're going to get rid of that logo. And we're actually going to replace it with the product name, which is Mobile Caregiver Plus. And that's actually going to happen tonight. So those of you that have been logging in, you may have never even noticed this TELUS thing here. It doesn't serve any functionality. But when you log in tomorrow, it's not going to say TELUS anymore. It's going to say Mobile Caregiver Plus. So probably not that big a deal. But on the mobile app, it's a little bit bigger deal because when the caregivers log into their mobile app starting, I think it should go into effect about 10 p.m. Central tonight. So once that goes into effect, when we load it into production, when the caregiver goes to sign into their mobile app, they're going to be requested to update the app. And we purposely do that so that that users don't get behind in versions and then start to have problems. So we really force them to do the update. The updates are very quick, assuming you have decent internet connection, and it's very easy to do. And if you've been using the app for a while, say for the last couple months, we do updates fairly frequently just to keep improvements on the app. So it's likely that your users have already done an update before, and this is not a big deal. However, what will be different this time is that the logo will look different. So right now, they're probably used to going to their app and looking for the TELUS EVV little logo. And when they do this update, that logo is going to change. So we created a website called fortelus.com/rebranding. You can go search that right now, and it will bring you to this website. I don't know if Brittany, if you can pop that into the chat so people can get to that. But it will bring you into this website. We added a few user guides depending on if you are an Apple user or an Android user. And when I click on that, it will give me this user guide. So I already clicked on that. Here's the user guide. And it will walk you through step-by-step instructions of what is going to happen and how to do it. So this is a picture of what the icon, the new icon is going to look like. It is very different than the existing icon. So I just don't want people to be surprised by that. So that's why we created the user guides and the website to walk people through it. And again, all this is going into effect around 10 o'clock Central tonight. Okay, so hopefully that helps you with some common things that we're hearing about and the update that is going into effect tonight. So let me go back to the PowerPoint. And Brian, I think I can turn things back over to you.
Great. So one of the things that we only have a few more slides to go through. And again, I want to thank everybody for joining us tonight. I know it's an evening and there's a lot. So thank you for joining us on a Thursday night. We do want to highlight again the call center. A lot of folks are writing my personal email or the EVV email that is DCH's, and you can continue to do that. That's perfectly fine. But the first thing I'm going to do is turn it back over to the conduit email. So save yourself a step and go directly to this email address or call this number or utilize the chat, and you won't have to wait for me to forward it to the call center, because you're going to see that literally what I'm doing, unless you have some higher level policy issue or higher level complaint, is I am just referencing back to the conduit call center. And that's important because that's where we track all of the comments, concerns, and questions. Next slide, please. So upcoming town halls, we will be doing one in August as well, and most likely in September. We are going to leave it open for what is most needed, just like we did on this presentation. We'll have one in the afternoon and one in the evening, just like we normally do. So go to that EVV schedule of events to sign up for August's town halls. This is just a snapshot, and we'll put this on the website of where we are with alternate EVV vendor updates. As you can see, folks are continuing to move through the process. We got a lot more folks testing at the moment and a lot more folks in pilot. So everything's moving from left to right, which we like to see. Folks like Rosemark and Access Care are in production now. There's quite a few of them that are. Just got a question about Rosemark earlier today, so it's good to see that they're in production. There are some here at the bottom that have declined integration. So if that is your third-party EVV, you need to be prepared to utilize the TELUS EVV fully, at least for CLS and PSS, because if they're not going to connect to us, then you won't be able to submit your claims through the EVV system. So you need to have that conversation with them right now. Okay, now we're at the Q&A section. Again, I'm going to leave up this Q&A number, which is the conduit Q&A number. The first question we have is about registering multiple passwords, multiple administrators for your different ID. We've told you that you need an ID for your CCSP, your source, and your ICWP, because those are different provider IDs. They may be 1234A, 1234B, 1234C. If you have one registered and you're having trouble registering the others, please call this number or utilize this email so that we at the call center can get through why there is a problem with you registering your source and ICWP IDs, but you didn't have a problem with your CCSP ID. The next question we have is in relation to rounding. The provider says, hey, I have been adjusting those manually at this time. So I can't tell you that we're okay with not paying for compensated care. As Medicaid, we have to pay for the care that is compensated up to the PA. But I understand this has been common billing practice, and I would not worry about any sort of audit exception. So I would not tell you to go back and adjust those times that you have manually updated, but I would ask that you have the conversation with your providers, with your employees, and say, hey, you know, this could lead to our members not having PAs when you stay late. So you need to make sure that as you can, you stay according to your timesheet as if at all possible. I got one more question in chat, which says, can you discuss again how RN with signed document timesheets on TELUS? And guys, please put your questions not in chat, but in Q&A. So you don't have to document anything that is already in EVV, but RN signature for oversight is not in EVV. So you will need to document that on paper. You can print out the information from TELUS, or you can keep a log, whatever is easier for you. But if it is contained in EVV, you don't have to redocument it. If it's not, you need to continue to do it on paper. How do you put in waiver claims is the next question. So EVV is specific to CLS and PSS. There is an entire claims module in training. I would request that you go look at that training module, and then if you have questions after doing that training module, you can call the call center or utilize the EVV mailbox to get further clarification. Or you could use that weekly Q&A training. You sign up for that, and they'll walk you through any of your claims questions after you've gone through the training with them. All right, let me check and make sure there's no other questions in the Q&A part. I got to get rid of the chat. The next question says, if the account is locked and it said try back in 30, what do you do? My guess would be you try back in 30. It's like any, and I'll let Joe speak on this, but I know I sometimes mess up my password and it locks me out for a period of time. Joe, is that?
That is correct. That I believe the system will lock you out after 5 attempts, incorrect attempts. So, you know, if you think if after 3 attempts you think, boy, I really don't remember my password, you may want to actually reset your password and just create a new one, because you may have just forgotten it. But if you continue to keep trying, then it will lock you out for a period of time, and you'll have to wait to be able to try more. So again, at that point, you may want to just reset your password, because it's likely that you have forgotten it.
Yep. And, you know, again, there's even a module in about resetting the password. So, and if you continue to get an error, yes, then you would call the call center. If you're still having problems with resetting that password, you would call the call center. That is correct. All righty. I think that's it for us today. So I don't see any other questions. If you have further questions, you can feel free to write them to the EVV mailbox, and we will answer them on an individual basis. Thank you for joining us tonight. I continue to appreciate your input, your Q&A, your comments and concerns. I hope you have a wonderful night.